My name's Chris. I work at the hospital in Idaho Falls on the cardiac floor. So I deal with a lot of heart patients who oftentimes have a lot of medications that they need to use in conjunction with each other. Okay, so they can sometimes get confusing. I don't know if you guys, a lot of people take a lot of medications. And as you take them, there's so much knowledge to know about medications that you end up sometimes just taking them. And you don't really know what you're doing, right? I've had lots of patients come in, or people that I've talked to that say, oh, I take the blue oval pill in the morning, and I take the gray one that's a circle at night. And that's great if they can stay up on it, but that doesn't help us, that doesn't help them take better care of their health. Okay? So why do you guys think it might be important to know more about your medications?
So when the doctor asks you, you can say, I fill the pill boxes every week, and I know what he takes and what I take.
Right.
You know.
Okay, so you can tell the doctor what you take.
I also read the side effects, and there's a lot of crap I don't take because of side effects.
Yeah, knowing side effects is huge.
Even an aspirin has side effects.
Oh yeah, all medications have side effects.
Yes.
What?
I have a little note in my purse, because every time I go in where they want to know what pills I take, then they spout off names, and I have no idea. So I ask them, well, what's that one for? And they don't know either.
Well, that's no good.
So I have this list. I just put out this list and give it to them.
Perfect. Well, that's
And
kind
the way I
of...
keep track of it is, if it's a prescription by a doctor, I see him, he looks it over.
Sure. Yeah, so what I did, I actually made this list for you guys as well, and it's going to be kind of similar. So what it has on it, the first column here, is the medication name. So just knowing what the name of the medication is helps you to be able to identify the medication, tell your doctor, so he can know what you're taking. The second one is purpose. Like you said, sometimes you get a medication, and you're like, why take this one? And you don't know why, right?
Because the doctor told me to.
Right, because the doctor told me to, right? Then, like you said, you want to refer to the doctor who gave it to you, right? Because he's the one that's going to know why you're taking it and so on. So I made another column for the doctor who prescribed it and their phone number, so you can call them and figure out, ask them any questions that you might have. The next one is the dose. The next one is the dose. How much of the medication you're taking?
Milligrams.
In milligrams or micrograms or whatever it's in, because it's important to know. A lot of the time I have patients come in, they might be on a medication that's really important for them to take. But if they don't know the name, the dose, and everything, then we're like, well, and we have a patient that's staying overnight and they need this medication at night, but they don't know what it's called or how much they take, it's really hard for us to help them, right?
But don't they won't even let you go into the hospital unless you tell them all your medications.
Well, they'll let you go in.
That's part of the pre-op.
My husband takes that first one on the back page.
Yes. So on the back page, let's skip to that. On the back page, I made an example. I put some common medications that people take. The first one you have here, metoprolol.
Yeah.
That one's for blood pressure. So I put an example, the purpose, how often you take it, and then I also made a column at the end called special instructions. Some medications have very specific things you need to know about them. For example, this last one, Coumadin. This one is
That's
really
nasty crap. That's rat poison.
Yeah.
It is. Warfarin.
Yeah, warfarin.
Yeah.
Same thing. So it's really important for people who have atrial fibrillation or some other thing. It's important for them to take it because it keeps their blood thin, stops them from getting clots and going into the brain and get strokes. So it's pretty important to take. But at the same time, it has, like you say, it's got some side effects.
Right.
So some things that you want to avoid, obviously, are other blood thinners that will thin the blood, or eating too much vitamin K will actually. Vitamin K is actually the antidote to Coumadin. So if you are taking Coumadin, but then you eat too much vitamin K, then the Coumadin is canceled out and it does you no good. So, anyways, the main thing, I'm running low on time. I wish I had more time. But the main thing you'll want to know is just to be able to do this for yourself. There's a few ways that you can find the information, because sometimes it gets confusing. Go online, you get tons of different stuff, right? That's why I put the phone number for your doctor. You can ask your doctor. You can go when you pick up the prescription at the pharmacy. You can talk to the pharmacist. He's a great person to ask.